afternoon, everybody. My name is Chris Bruni. I'm the Vice President of Sales at Security Health Plan. Very pleased to be with you again today for another installment of our webinar Wednesdays. This is a production that's co-sponsored by Marshfield Clinic Health System and Security Health Plan. And our goal is to bring you topics that are kind of fitting to our employer audience. And so we do appreciate your feedback. We do surveys after this, and if you have topics that you want to hear more about, we would love to hear from you and how we can continue to improve this going forward. Just to let everybody know, we are recording this presentation. It will be sent out. Ashley will send it out to everybody that did pre-register. Once the event is over, that's typically the next day, that she'll get that out to everybody. And again, we do populate this then on the Security Health Plan website. So if you go to our COVID-19 tab at the beginning of our website there and take you to that page, and then there's an employer tab within that. You'll find this presentation and all the other ones or links to all the other ones there as well. So feel free to share those or listen again at your leisure. I do want to point out that we do have a chat and a Q&A feature here as well, and so please feel free to use that. We will do our very best to answer each and every question during the course of the presentation today. We typically save them up till the end, but if there's something that we feel is urgent, we will chime in and interrupt Amanda as she's speaking. So, but please use that feature and ask your questions, and we'll do our very best to get them answered. If we can't get through them all today, or we have one that you stump us with, we will do our best to get that out to you with the recording that's sent out in the email the next day. So, with that said, Amanda, I'm going to be introducing you now, and very pleased to have this topic front and center for our audience today. Amanda Siegler is our guest speaker today. She is a clinical pharmacy specialist at Security Health Plan and works in leading our commercial medication therapy management program, or MTM as we call it there. Amanda completed her education process through the University of Wisconsin down in Madison, as well as through the University of Minnesota. So she got her Doctor of Pharmacy at Wisconsin, and then did her residency over in Minnesota, and has been with our group, as I think I mentioned earlier, about 3 years. So Amanda, without further ado, I'm going to pass this baton on to you and lead us through medication therapy management.
Thank you, Chris. And I'm excited to be here with you today to speak and to share some information on a program that we offer at Security Health Plan, and it's called Medication Therapy Management, or what I'll commonly refer to this as is MTM. And so really, this slide is just kind of an introduction. So those that we might be able to help with this service is anyone taking more than a few medications at a time, anyone that's taking over-the-counter drugs or supplements. You know, those would all be good reasons to have a visit with one of our pharmacists. And really what we look for during the visit is we kind of take an overall look at how everything together is working. And we just want to make sure that, you know, everything is really working to the best potential. And we really look at all of those meds individually versus sometimes when you go to the doctor, they may be more focused on, say, you know, looking at the prescription medications, but some of those supplements might be missed. So we do have software that looks at, you know, any special drug interactions that might result in taking additional supplements. And we really do take the extra time to review these, kind of the full medication profile. So during our short time together today, we'll just be kind of going over some of the basics. So what is this service that we call MTM? Who is it for? You know, why is this a good idea to participate in? We have a few success stories to share, and then we also have a slide where we will introduce the pharmacy team here at Security Health Plan. And really, this service that we're offering, it's unique to our health plan because we do offer the service to both Medicare patients and commercial patients versus many health plans just offer this for their Medicare population. So really this is an added benefit that you would get by choosing Security Health Plan for your insurance. And we, we really do enjoy offering this service. So I'm excited to tell you a little bit more as the presentation goes on. So this next slide is just an introduction here to what is MTM. So I want to really stress this is a free annual medication review, really eligible to any of our clients that have the pharmacy benefit through Security Health Plan. And generally the service takes anywhere from 10 to 15 minutes. Could take longer based on the patient questions and the length of the medication list. And really, the visit is individualized to each patient. So, any goals that they have or questions, we want to make sure that we're addressing those first. Our pharmacists that provide the service, we are local and very experienced in managing medications. So you will get to talk, the patients will get to talk with someone one-on-one, that really understands our state, our geography, and then, maybe some unique circumstances that might happen, just for instance, say due to COVID-19 and things like that. And then at the end of every visit, what we do is we take a visit summary, and that is then sent to first the patient. It has their full med list, any recommendations that were made, and then a copy of recommendations would also go to their doctor if there was certain interventions that the doctor might be able to help with. And so that gets directly faxed over to the doctor. And that's just so that everyone is on the same page with what was discussed. And many times the providers are able to make some changes right away and then send new prescriptions to the pharmacy. So just kind of curious, for those of you on the call, have any of you heard of this service before, or has anyone had employees that work for them take advantage of this service? Any feedback would be great if you just want to make a comment in the chat section, and just kind of wanted to get a feel of, how many were already familiar with this, and so maybe just take a second to, if you're familiar or not familiar.
Yeah, and Amanda, we'll monitor that throughout the presentation so we can keep moving.
Excellent. Okay.
Hopefully people will chime in, and if there's something that we want to
Perfect.
interrupt you with, we'll go ahead and do that.
That sounds great. Thanks, Chris. All right. So this next slide, we're going to go over just a few reasons of why folks should take advantage of this service here. So really, the primary goal is we want to make sure that patients and members are really getting the most from their medications. Just want to make sure everything's working okay, and that they're able to take everything in a way that makes sense to them. A priority that I always stress, and many of our pharmacists also, kind of put this at the top of their bracket, is safety. So is there anything on that medication list that could result in any harm to our patients? So I just have, one story that's fresh in my mind on just a safety intervention we were able to help with. So frequently when we do these visits, sometimes we'll be talking with patients who have recently been discharged from the hospital. And we happen to have, a patient we're working with and kind of looked at the medication list as we were going through and noticed unusually that they're on 2 different blood thinners. Usually you're just on one of these at a time because kind of duplicating therapy that can really result in a dangerous bleeding event. And so the patient really couldn't remember, what the doctor had said about the blood thinners. She had one prior to going into the hospital, got another one after getting out of the hospital, and just kept taking them both. So what I was able to do is get on the phone with her doctors and find out what the plan was for her moving forward, and we're able to tell her to stop taking the medication that should have been stopped at hospital discharge. So really that's just one example of a safety intervention that we made. Likely if she would have kept taking these 2 harmful medications together with that duplicate therapy, this could have resulted in a future hospital visit. So I'm happy to have that patient now on the right medications and keeping them out of the hospital. Another thing that we look at is how the medications are organized. So are there any interventions we can make, like implementing a pill box or maybe an alarm to go off when certain medications are due? Another big thing that we're always looking at is cost. So is there a way, to make these medications more cost effective for our patients? So we have a few different things that we'll look at when we're doing these reviews. So I look for any brand medications that might be expensive. Are we able to convert someone over to generics? So we take a look at that. We also take a look, are there any benefits that their health plan or that their employer offer to them that aren't being taken advantage of? So a few examples of this, we do offer an add-on over-the-counter benefit where if the plan has this, members are able to take advantage of a $30 quarterly allowance for their family for over-the-counter medications. So this is something I'm constantly looking at. Do they have this benefit? Have they used it before? Are they on over-the-counter medications that we can have them order through this program to help save them some out-of-pocket costs? Also looking at, we also do have preventative benefits that employers and health plans can purchase. So we offer on this preventative list many different classes of medications, blood pressure, cholesterol, inhalers, diabetes medications. So if their plan does have this, I'm always looking for ways to maybe switch people over to medications that are on our list, if that would be a good alternative. And then the member is able to get those medications for $0 copay. So always really looking for any ways to save money, make life a little bit easier for patients. I know sometimes those prescriptions can really add up, and sometimes it's even just one medication really driving drug spend. So always looking for ways to help out. And we have 2 pharmacy technicians on our team also, and they really do go above and beyond to help, with the cost savings, and they will also, go out of their way to look for coupons and things for members if it's something that we can't offer in-house. So those are just kind of a few reasons, why these medication visits are great to do. I want to stress that these are really, they're individualized and they're focused on the patient. So if the patient just wants to talk about, their diabetes at a visit and focus on that, we're really able to hone in and offer that customization. And so there are a few different ways to get started with the service. So we do proactively look at our member list and population. And so currently, any patient that has 3 or more chronic medical conditions that are taking 6 or more medications, for our commercial population, then we flag them on a list that comes to us for the medication review. And for a Medicare population, it's a very similar process, but they also look at quarterly drug spend. And so for both populations, every quarter we do send out letters to our members to invite them to call in and have a visit with one of our pharmacists. And then we do frequently make outreach calls on a daily basis. So every year we do try to contact each patient on our list at least once if we can. So if you've got employees that receive one of these letters or get one of these phone calls, make sure that they're taking advantage of this opportunity. And then also we do have a dedicated MTM phone line where patients could call. Security Health Plan members can call at any time to set up a medication visit. So really two routes, and we try to be as flexible as we can with accommodating patient requests to get them in for a visit. And so I just wanted to share some success stories that we've had from people that have participated in the program, and really much of the feedback that I've gotten personally, a lot of people really do enjoy the service and having that second set of eyes look over their medications, especially with the changing times with the COVID pandemic. Sometimes it's harder for people to get into their doctor, or they might be scared to go into the office. This service that we're offering, it's 100% over the phone. So there's no travel required, and many times if it's a concern that we can fix, between our pharmacy team, the patient, and the doctor, that may be preventing a doctor's visit by just helping to get those concerns out there and addressed in a timely manner. And I just wanted to show one example of like a cost savings that we can offer. So this patient example that I've got here, it's really talking about one of the visits that we had where a member's inhaler copays were just too high, and then also having some concerns on their antidepressant medication. So we were able to recommend a lower cost inhaler and switch it from Delera, which is a brand name, over to a generic name inhaler, and saving that patient about $200 a month in their copay they were responsible for, and then also able to help with some of the concerns on their antidepressant. And it turns out that there was a longer acting dosage form available that we were able to switch them to. And then both of these recommendations were something that we could resolve right away by reaching out to the provider through fax, and the provider was able to get those new prescriptions over to the pharmacy and save them a doctor's visit. So this slide, so right now at Security Health Plan, we have 2 dedicated pharmacists to offering the MTM services. So there's myself, and then I'm mainly responsible for our commercial population. And then we have another great pharmacist named Kurt, and he is in charge of the Medicare Part D program. So if you took advantage of this service, you would likely be speaking with one of us, and both of us have, we're well versed in MTM. We've completed the pharmacy residencies and then gone on to become board certified to really get a good grasp on all of the guidelines and the different skills that go into managing patient medications. So this slide here, to set up an appointment, this is our dedicated MTM line to get started. And this is mainly for our patients to call and members to set up visits. And we primarily operate at these times here on the slide, but we are flexible too if there are certain requests for visits. So please, if anyone is interested or has employees that might be interested, take advantage of this and give us a call. And that was all that I had kind of prepared ahead of time for this talk. So we will take this last few minutes to answer any questions that you might have. And
yeah, Amanda, a couple of questions that have come up. So how long has Security Health Plan actually been doing the program, and do you have any idea about how many members you've been able to impact over that period of time?
sure. So we've been doing the commercial MTM program. These services just started in 2018. So fairly new for the commercial, and then I believe for the Medicare population, we had started a few years prior to the commercial implementation. I can't remember the exact date because I joined the team right around 2018.
Mm-hmm.
And member impact, for last year, we touched about 1,000 commercial patient cases, and I would have to get back to you on the exact number of Medicare patients that we were able to provide the service for.
Okay. And then another question, you kind of touched on this in your example, which I thought was a good example because it kind of outlined some of the steps in the program. But has there been any pushback from providers or pharmacies about the interactions between our team and our membership?
That's a great question, and I would say, thankfully, we've kind of been paving the way now for at least a few years now with the service, and generally the responses that we get from providers are very very positive feedback that we've gotten. And it seems like we're really only sending them any recommendations that are really pertinent to the patient, and it seems like overall they are receptive at getting things implemented for us.
And then have you encountered that situation? I'm guessing it happens where maybe the providers don't realize all the different medications that a patient is on. And so you're talking to this provider about this potential change and a different provider about this potential change? Has there been impacts on patient health from that perspective, or just getting them maybe better management?
I think so. Especially with those supplements, have a lot of interventions that go out on, common supplements people take, and not knowing that they might interact with some of their heart medications, and so things like that, just getting the word across that, hey, their prescription medications are okay, but then there's also some of these extra supplements, kind of that have shown up that are not so safe. And I think, after you send out a few of those recommendations, you kind of start to see providers say, hey, maybe this is something I could look at too during my visit.
Great. Great. We don't have any other questions in the queue.
Okay.
Amanda, you did a great job. This was very good information. Again, everybody, this is a free service, so encourage your clients to take advantage of this. It's just a phone call away, and hopefully we can have a real positive impact on a person's life that's taken a bunch of different medications, or even if they're just taking one or two, Amanda, you might have a great impact on their life. So really appreciate you coming on today and talking through this with everybody and making everybody aware of it. And again, if you have other questions, want to reach out to your account managers, you can do that. They can get you more information on this as well. But again, Amanda, appreciate your time today and appreciate everybody's attendance. Thank you so much for joining, and be well, everybody. Have a great rest of the week.
Thank you, and thanks for having me. It was nice to speak with everyone today.
Yeah, our pleasure. You did great. Thank you. Bye-bye, everybody.
Bye-bye.